Hi Mary, how are you today?
I'm good.
Okay, my name is Anna and I'm your speech language pathologist and I'll be giving you a bedside swallow evaluation. And there's two parts to the evaluation. The first part I'm going to check your oral structures and functions, and the second part I'm going to give you different foods and liquids that have different consistencies. I'm going to be checking your swallowing mechanism. Okay? You have any questions? Feel free to ask me at any time if you do. So first I want to make sure you're sitting up tall and straight at a 90-degree angle. Looks like you are. Great. And now I want you to hold your breath for 6 seconds. Okay, great. Good job. And now I'm going to look in your mouth. And I see your lower teeth, your upper teeth, your uvula, your fascial pillars, and your lateral sulci. And everything looks great. And now I'm going to check your jaw movement. Can you open and close your jaw like this? Okay. Now I'm going to press up on your chin. I want you to try to open it. Great. And now I'm going to press down. And I want you to try to close it. Great. Good job. Now can you move your jaw side to side? Great. Now can you protrude your jaw like this, like you have an underbite? Good job. And now I want to look at your lips. Can you do this? Make a smile. And then I want you to fill your cheeks with air like this. Good job. Now I'm going to use a tongue depressor and put it in between your lips, not your teeth. And I'm going to be pulling on this. I want you to try to resist that pull. Good job. Great. Lip seal. Now can you stick your tongue out for me? And then move it side to side. And then stick back in. Thank you. And next I want you to pretend you have peanut butter on the roof of your mouth and scrape it. Pretend you're scraping it off from the top. Good job. And now can you lift your tongue inside your mouth and then outside your mouth? And then can you lick your lower lip and your top lip? Good job. Now I'm going to touch your cheek, and I want you to push your tongue. I want you to use your tongue to push against it. Okay, and the other side. Great, good job. Now I want you to position your tongue in your mouth like you're going to say gut, 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 but without saying it. Good job. And now I'm going to have you say different sounds. I'm just going to be checking your rhythm and your rate. So can you say puh, puh, puh for 10 seconds?
Puh, 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 puh.
Okay, great. And now tut, tut, tut.
Tut, 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 tut.
Okay, good job. And now cuh, cuh, cuh.
Cuh, 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 cuh.
Okay, good job. And the last one, we're going to put them all together and say patika, patika.
Patika, 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 patika.
Okay, good job. Thank you. Now I'm going to put my tongue depressor in your mouth, and I want you to say ah for me. Ah. Okay, good job. And now I am going to check your gag reflex. I'm going to start at the tip of your tongue and slowly walk it back until I get a gag reflex. Okay, ready? Okay, sorry about that. Thank you. Now I'm going to check your oral sensitivity. I'm going to swipe the sides of your tongue, and whichever side you feel, I want you to just raise that hand for me. Okay? And thank you. And now I'm going to do the same thing with your cheeks. So just once again, raise this hand that you feel the side on. Good job. And now I want you to say ah. Ah. Okay? And now just take a big deep breath and then say ah for as long as you can. Ah. Okay, good job. And next I want you to raise your pitch like this. Ah. Ah. Good job. And now can you cough like this into your elbow? And then can you clear your throat like this? Good job. The last thing for this part of the evaluation, I'm going to check for your dry swallow. A dry swallow is when you swallow without any foods or liquids in your mouth. So is it okay if I place my fingers on your throat?
Sure.
Okay. I'm just going to check for your swallow. You can go ahead and swallow. Okay, good job. And that's where our evaluation is completed. Do you have any questions?
No, ma'am.
Okay, then we'll just move on to the next part. So the next portion of the bedside swallow evaluation is the food trials. I'm going to be presenting you with drinks and foods. First we have water, and we have pudding, diced fruit, which I have pineapple, and a sandwich. At the end of when you swallow each time, I'm going to place my fingers on your throat like I just did, just to check your swallowing each time. And after every bite, I want you to say, ah, just so I can check for a gurgling sound that indicates there's any foods or liquids in your lungs. So we should go ahead and get started. Do you have any questions? No? Okay. First thing I'm going to do is give you a little bit of water on this spoon. Okay, good job. And now I'm going to give you just a little bit more. Okay, great. And now I'm going to give you a drink of water from this cup. I'm just going to give you a little sip. Good job, thank you. And this time I'm going to let you take a sip from the cup on your own. I'm just going to place my fingers. Okay, thank you. And then this time I'm going to use a straw. I'm going to let you take a sip from the straw. Good job. And now I'm going to let you take your own sip from the straw. Oh, sorry. Okay, great. And now I want you to take just a couple sips in a row. Okay, thank you. And next we have pudding. I'll start by giving you a little bit on the end of the spoon. Okay, and now I'm just going to give you a little bit more. Sorry, first I'm going to check your mouth for residue. Okay, great. And now I'm just going to give you just a little bit more pudding on the spoon. Good job. Okay. Now I'm even going to give you a little bit more. Okay, great. Check again. Okay. And now I'm going to let you take your own spoonful that you would normally feed to yourself. And I'll just place my hand under here. Good job. Let me check. Just again, I'm just checking for residue left in the mouth. Good job. Thank you. And now, next I'll be giving you some diced fruit, which we have pineapple, and I'm going to start by just giving you a half teaspoon of the pineapple. Good job, thank you. Okay. And now I'm just going to give you a little bit more of fruit this time. Great, good job. And now I'm going to let you take your own spoonful, whatever you would normally take. I'm sorry, I forgot to check your mouth for residue after that fruit swallow. So now I will let you take your own spoonful of pineapple, just whatever you would normally take. I have a sandwich. First thing I'm going to give you is just a small bite size. Just take your time chewing. Okay. Great. And now I'm going to give you just a little bit bigger bite size of the sandwich. Okay. Great. And last thing I'm going to do is I'm going to give you the sandwich and I'm going to let you take your own bite. That would be a normal size bite for you. I'm just going to place my fingers under here again. Okay. I'll check one more time. Good job. Oh, sorry. Okay, and I believe that's it. And you did excellent. Do you have any questions for me?
Mm-hmm.
Okay, well, thank you for coming in.
Thank you.